The hidden dangers of belly fat. Understanding the risks and solutions. Maintaining a healthy midsection is crucial for overall well-being. Excess belly fat not only affects your appearance but also increases the risk of serious health conditions like diabetes, cancer, and heart disease. In this article, we'll explore the different types of belly fat, their risks, and effective ways to reduce them. Types of belly fat. There are two main types of belly fat: subcutaneous fat and visceral fat. Subcutaneous fat. This type of fat is located just beneath the skin and can be pinched with your fingers. While some subcutaneous fat is normal, excessive accumulation can lead to health problems like heart disease, stroke, and type 2 diabetes. Visceral fat. This type of fat is found deep in the abdominal cavity, surrounding vital organs like the liver, intestines, and heart. Visceral fat is more dangerous than subcutaneous fat and is linked to various health issues. Causes of belly fat. Belly fat can be caused by a combination of genetic and environmental factors, including unhealthy diet, sedentary lifestyle, low muscle mass, insulin resistance or diabetes. Measuring belly fat. You can measure your belly fat by calculating your body mass index, BMI. Measuring your waist size, men, over 40 inches, women, over 35 inches. Risks associated with belly fat. Excess belly fat can lead to high blood pressure, certain types of cancer, stroke, non-alcoholic fatty liver disease, early death from any cause, sleep apnea, high blood sugar, and diabetes, heart disease. Reducing belly fat. While it's impossible to target specific areas for fat loss, incorporating exercises that burn overall body fat can help reduce belly fat. A combination of cardio, strength training, and high-intensity interval training, HIIT, can be effective in reducing belly fat. Conclusion: belly fat is a serious health concern that requires attention. By understanding the risks and types of belly fat, you can take the first step towards a healthier lifestyle. Incorporate exercises that promote overall fat loss, and make informed choices to reduce your risk of developing related health conditions.